Today we're going to talk about applying sterile gloves and manual suctioning. While most children do have an inline suction catheter attached to their ventilator tubing, there may come a time where it is more appropriate to perform manual suctioning. Carefully open up the package that contains the catheter and the gloves. You do not want to touch within the package, but hold on to the border. So what we're going to do is pinch the cuff of the first glove and carefully pull it off of the other one without touching the table. Now slide your hand inside without touching the clean part of the glove. This cuff is dirty, but this part of the glove that is now covering my hand is clean. Now we're going to take the clean part of the glove and slide the fingers under the cuff of the one on the table. If the packaging starts to move, feel free to stabilize it with the other hand, but don't touch inside where the catheter still is. Now, see how my fingers are inside this glove? This part of the glove is clean, but this outside of the cuff is dirty. So you're going to take your ungloved hand and you're going to slide it inside, and if you need to adjust. Now, if this were to happen where your fingers get caught up somewhere, remember this glove is clean and the hand of this glove is clean. So now take both gloved hands and adjust your fingers. If for some reason this happens on your first glove, do not take an ungloved hand and try to adjust. You can only adjust the tip of the glove with the other glove. So now we are going to perform manual suctioning. If your child is already attached to a ventilator, feel free to use that as their oxygen source between suction passes. If they are not, go ahead and get an ambu bag. Yours may look something like this. They can be blue and a little smaller. And go ahead and turn the oxygen up between 12 to 15 liters, or 100% if you're going to use the ventilator. Next, if your child is hooked up to the inline suction catheter, go ahead and unhook the suctioning device. If not, go ahead and pull it out and put the suctioning between 80 and 120. Now we want to make sure we have everything ready before we put on our clean gloves, because once they're on, we cannot touch things around. Now, if your child does have their ventilator attached for oxygen, go ahead and loosen it from the tracheostomy tubing, as you'll need it to come off and put back on easily. Now let's open up our glove, pinch the cuff, and slide your hand inside. Take your other hand and slide it under the cuff, and slide your hand inside. Now that we have our sterile gloves on, we're going to grab the suction catheter, and I like to wrap it around my hand to make sure that it doesn't touch anything unclean. Hold on to the catheter port, and with your non-dominant hand, grab the suction tubing and attach it to the catheter. Now that this hand has touched the tubing, it is no longer clean. So when you unswirl, you will be able to suction with this hand, but you cannot touch the port with the clean hand. If your child is not attached to a ventilator, go ahead and take your ambu bag and give them 3 breaths. And looking at the markings, if you have a length of 8, like it is for this child, you're going to pinch at the 8 and slowly slide inside. And when you see the 8 reach the hub of the catheter, go ahead and apply suctioning and swirl the tubing as you come out. If you have an ambu bag, go ahead and attach it and give your child 3 breaths. Once you've disconnected your suction catheter, go ahead, put it inside the glove, and throw it away. We will not use this again. We will have to open up a new pack for the next time we want to do manual suctioning.